Thank you for being here.
Oh yes, it's my pleasure.
Flu shots, it's a polarizing discussion, especially if you put it on any kind of chat forum or social media. There are people who are absolutely against it and absolutely for it. Certainly a personal decision. With H1N1, there seems to be more of a push from the medical community to actually get immunized. What's the reason behind that?
Right, so the H1N1 this year is the dominant strain of the flu vaccine, and what we're finding is that the H1N1 tends to affect younger people. So it affects people in their 30s, 40s, 50s, children, pregnant women. So all these people are more likely to get the influenza. Normally, we see the flu affecting older people. So I think that's what's causing so much alarm in the community.
We learned a lot about H1N1 in 2009, but what are the dangers associated with this strain? Why are people so why is this different than your regular strain of the flu, or is it?
Okay, so normally in Canada, 10 to 20% of people get the flu every year.
Right.
There's about 20,000 hospitalizations every year, and 2,000 to 4,000 people die of the flu every year.
Really?
So it's not unusual for people to be getting sick from the flu. It's not unusual for people to be getting hospitalized from the flu, and unfortunately, it's not unusual for people to be dying of the flu. What's different is that it tends to be younger people this year. So we're seeing children being hospitalized, pregnant women being hospitalized, people in their middle ages being hospitalized. Many of these people do have risk factors.
Right, pre-existing conditions?
Exactly.
Right.
Some people don't, but many of them do. And what we're also seeing is that the people who are getting infected with H1N1 as opposed to the other seasonal flu viruses do tend to be a little bit sicker. So that's maybe another thing that's causing people to be concerned.
Why is it such a big news story that what is happening in Alberta right now?
What happened in Alberta was that there was a surge, so there was a sudden burst of cases, and some of those cases were in children, so that's probably why people were concerned.
Causing panic. And doing some research on it, thousands of people lining up now for that H1N1 vaccine. Is it too late to get vaccinated?
It is not too late to get vaccinated. So the flu vaccine contains protection against 3 strains. One of those strains is the H1N1. Even if you got the H1N1 in 2009 or got the vaccine in 2009, you should still get it and refresh your immunity because the virus can mutate. Even if you think you've had the flu already, you should still get the flu shot because you'll still have protection against the other 2 strains if you get the vaccine. Also, many people who get the flu actually don't get the flu. They get like a cold or a flu-like virus. So
and if you get the flu, do antibiotics work against the flu?
So flu antibiotics don't work. Antibiotics do work against pneumonia if you catch like an additional bacterial pneumonia with the flu. Antivirals do work. So for people who are very sick, for people who have chronic illness, people who are at risk of getting complications from the flu, then we do usually recommend antivirals. So we would suggest that those people get assessed early. So if you're really sick, if you have chest pain, shortness of breath, really, really dizzy, confused, your sickness is getting more and more severe, not getting better, and especially for people who have chronic illness, they should go get seen early.
Okay, so seen early, you want to get to the doctor if you have a pre-existing condition and get to the point where you think this is unusually sick.
Exactly.
And how do you spot that in your child?
You can tell when they're sort of not behaving as usual, when they're really, really tired, their fever's not going away, even with Tylenol, they're throwing up, can't keep anything down, getting really dehydrated.
That's a concern.
Exactly. If you're not sure, call your doctor. There's also a non-emergency health line called the Nurses Line at 811. It's free. You can call that. It's on the Immunize BC website.
That is a great tool for parents. One of the questions that have so many myths surrounded with it is, how long before you have the flu are you contagious? How long when you have the symptoms are you contagious? And how long after the fact? Like, should you stay home from work if all of a sudden you feel like you've been hit by a truck?
So you can be sick for 1 to 2 days and not know it and still be contagious with the flu. And that's why we recommend everyone to get the flu shot, especially if you're in close contact with people who are at high risk, because you might accidentally pass them the flu.
Right.
And once you catch the flu, I do recommend for people to stay at home. Don't go to work and spread it around. Don't go shopping. Don't go to the mall.
Right. 1 day, 2 days? Is it a matter of hours?
Until you feel better.
So really it is until you feel better. You don't try and force it and go back to work while you're still oozing out of every nose, ear, eye.
You'll get better faster if you rest as well, right? Rest, drink fluids, wash your hands, cough into your arm.
Right.
All those usual things.
Germ catcher.
Yes.
Teach the kid the germ catcher. And washing hands, you can't stress that enough, especially when you think about all the things you touch in a day.
Exactly.
Riaz has taught me that.
Okay.
Seriously, thank you, Dr. Lu, for being here. We appreciate it, clarifying it. Personal choice, whether or not to have a flu shot, but from a professional physician's experience, if you're at risk, get this shot for this strain.
Yes.